Hey, did you know that 1 in 4 people will have mental illness and yet 2/3 will not seek help due to the stigmas surrounding mental illness? Talk about it in a second. Hey, so out of the 2/3 that do not go and get help due to stigma attached to it, whether it's through the family, whether it's through the friends, whether it's through the work colleagues, or whether it's just through society as itself, going to school, colleges, universities, stigma is always attached from many different areas, and a lot of people will not get help due to the stigma that will attach to them. When I hear the words stigma, I think of mental abuse and verbal abuse that people give out to people in society that can't help the illness that they have been given. You would never talk to people with cancer or with brain tumors or with any other illness the same way as people are treated with mental illness and bipolar and any of the ones. People need to educate themselves better on mental illness. We need to go around to public schools and private schools and educate young children and adults about the terms of mental illness and abuse that they give to other people. I think education is the best way to go. This is the way to help prevent people calling other people crazy and psycho and an idiot, and stupid and dumb. These are where we start off as a young child, and this is what parents have taught kids, because for a long time it was the norm that you could call somebody psycho and stupid and dumb. So I think right now we need to change the tables and turn it around, and let's start talking about it, but yeah, let's use non-derogatory terms. In the workplace, there also should be classes taught to co-workers and everybody else, bosses, management, and such, about the different effects of mental illness and also the stigmas that is attached to it. It is not fair that somebody is not promoted because they have a mental illness or even hired because they have one. This is why not many people will seek help, because it can go against them in many different ways. I, on the other hand, don't care what people think about me. Bipolar and other mental illnesses in the workplace, in the schools, but yet we're not forgetting about in the households. This is the place where parents, sisters, brothers, aunts, uncles, grandparents talk to other people about different mental illnesses. You hear it around a kitchen table where people are still using derogatory terms, but yeah, let's educate each other at home about the different terms that you can use. Some people, when they're young and they develop a different illness or psychosis or anything in that direction, do not go and get help because they hear it around the table of other people using derogatory terms and they don't want to be classed as that same kind of person. So let's recap the situation. So 1 in 4 people have a mental illness, but yet 2/3 do not go and seek help. This is a proven fact. It's from the Medical Institute. But also we need to educate people, whether it's schools, in the household, in the workplace. We need to also treat each other with better respect and dignity. And I'd like to know, have you ever been attached to a stigma and would like to put it in the comment section? And let's work from there. Let's have a conversation about it. I have had a stigma thrown at me a few times, but normally by people that don't know. And then once I tell them that I've got a mental illness, then they look at me totally different, and how can I explain it? They look at me totally different, and then I have to reassure them that I am fine, I am well, and that I am not a person that they think that I am crazy, or I am psycho, or I am stupid, or I am dumb. I am not. I am a human being. I take medication. I see a therapist. I have a psychiatrist. I build a great team of friends around me. So I'm in a blessed position where I can talk about my psychosis and my bipolar and my mental health and everything else. So thank you for listening, and please leave messages in the comments, subscribe, like, share, ring a bell if the bell is still there, I don't know. Anyway, I'll talk to you soon, and we'll talk about my medications in the next video. Thanks everybody, thanks for listening, appreciate it.